Hi, hello, aspirants. Welcome to Agni Nursing Academy. First of all, I want to wish you all the very best for your PGI examination. Okay, that will be held on the 21st and 22nd this month. Okay, then if you want to enjoy a day means you can play the games. Okay, play games, watch movies, whatever you want to do. Okay, small things you can do. If you want to enjoy the 1 week, you can make the trip. Okay, and do the trips with the friends. If you want to enjoy a month means you can travel. Okay, if you want to enjoy whole life means just study. Okay, study for the particular time period and get your dream job. Okay, dream job, automatically you will enjoy whole day, whole week, whole month. Okay, get just study and get your dream job. Okay, then to the next question. First question, that is, for blood donation, a donor should have hemoglobin level above. In this question, they are asking on the hemoglobin should be, how much hemoglobin should be there for the donor. They are asking some, let us discuss on the some conditions for the blood donor. Okay, conditions for the blood donor. First one, that is, first condition is age limit for the blood donor, that is 18 to 65 year. Okay, 18 to 60, between the 18 to 65 year you can donate the blood, you are eligible for the blood donation. Then coming to the HB level, how much HB should be you have to maintain for the blood donor, that is more than 12 gram. Okay, more than 12 gram. Then move on to the weight. Next one, how much weight should be there for the blood donor, that is around 45 to 50 kg. If a donor having the 45 to 50 kg, he is eligible for the blood donation. If the patient donor having less than 55 means is not eligible for blood donation. Then the last donation, there is a some days gap between the first donation and the second donation, that is the last donation. There is minimum 90 days. Okay, minimum 90 days gap between previous donation. Okay, then only is eligible for the blood donation. Then coming to the infection, patient never be positive for the HIV positive. Okay, never positive for the HIV infection, and also there is no infection for, okay, there is no infection, no infections in the present. Okay, no infection in the present and never be positive for the HIV. These are all the conditions. And age limit will be 18 to 65, HB level more than 12 gram, weight will be more than 45 to 50. Last donation, there is a 90 days gap between the last donation, and the infection is never be positive for the HIV and present infections also. Okay. And then coming to the question, in this question they are asking the hemoglobin level. Here already I told you that is minimum 12 gram percent. In the question they are confusing. 12 gram percent means 12 gram per deciliter. Okay, 12 grams per 100 ml of blood. Okay, this is the our hemoglobin. Then move on to the next question. Next question is, under normal circumstances, concentration of oxygen in the inspired air is about dash percentage. In this question, they are asking the oxygen concentration in the inspired air. That is, inspired air means atmospheric air. Okay, atmospheric air. Let us discuss on the how much concentration of O2 will be in the inspired air and expired air. Then coming to the inspired air, in the inspired air there will be 21% of O2 concentration, and coming to the CO2 will be 0.03%. Then nitrogen will be 78% in our atmospheric air. Then coming to the expired air, that is after exchange of gas, we will exhale or expire our air. That is O2 will be 16%. Okay. Then CO2 will be 4%, and nitrogen won't exchange in the blood. Okay, we won't take the nitrogen as it is, it will come out. Then in the question they are asking the oxygen concentration of inspired air. Okay, that is 21%. Okay, one more thing is there. Here in the expired air, they will see the 16% of O2. During the CPR, we will give the mouth to mouth rescue breathing. During that rescue breathing, we will deliver the 16% of O2 to the victim. This is also important, okay, important, make it important. Then move to the some important aspect, that is external respiration and internal respiration. Where will it will happen? Let us discuss on that. This external respiration will takes place in the lungs, okay, that is in the lungs. Let us consider this is our alveoli, okay, this is our alveoli. Here the blood vessel coming from the right atrium and okay, right atrium, that is pulmonary artery, that is converted into small vessel. In this vessel we have oxygen, okay, partial pressure of O2 will be 40 and PCO2 will be 45. This is a deoxygenated blood. So here in the alveoli we have PO2 will be 104, then PCO2 will be 40. See, after air exchange, okay, we will take inspiration and expiration. Now air exchange will happen. After that, after exchange, what we will see, PO2 will be 95 and PCO2 will be 40. Here carbon dioxide went outside and oxygen get inside. This is our external respiration. Then coming to the internal respiration, it will happen in the tissue level, okay, tissue level. Consider this is our tissue. Here the blood, okay, blood vessel is there. Here one blood vessel is there, okay. This is artery, consider this is the artery. Then now air exchange in the external respiration happen and air exchange happen, that is PO2 will be 95 and PCO2 will be 40. In the tissue that oxygen pressure will be 40, okay, nearly equal to 40. Then PCO2 will be 45 because tissue is using oxygen and producing CO2, that's why 45 is there. After exchange, what will happen in the venous blood, okay, this is vein. Now the concentration, okay, O2 pressure will be 40 and CO2 will be 45. See, in this case we will see the only CO2 exchange, okay. In the tissue it will be constant, okay, 40, O2 will be constant. Then move on to the next some important points, that is oxygen transport. In the what, in which form oxygen will be traveling the blood. See, 90 to 99%, 98 to 99% bind with the hemoglobin and form the oxyhemoglobin. This is the form of oxygen travel in the blood. Oxyhemoglobin. Then 1 to 2% dissolved in the plasma. Then move on to the next one. CO2. CO2 transport in the blood in the form of 70% bicarbonate in the plasma. Okay, bicarbonate in the plasma. This is also important. Then 23% bind with the hemoglobin and forming the carbamine hemoglobin. Then 7% dissolved in the plasma. And in this important is carb hemoglobin, okay, oxyhemoglobin, that is form of oxygen traveling the blood, and bicarbonate, that is in the plasma, and carbaminohemoglobin in the blood combined with the HB. Then coming to the question already discussed, correct answer of this question is A. Then move on to the next question. Massive or rapid administration of blood containing citrate causes. See, in this question they asked on the citrate. See, citrate. What will happen if we administer the blood in massive or rapid? Okay. Now let us discuss on the massive blood transfusion. That is how we can say the massive blood transfusion. That is if we administer the more than 10, okay, 10 or more than 10 PRBC, okay. PRBC transfuse within the 24 hours, okay, within 24 hours. Within 24 hours, if we transfuse the more than 10 PRBC, means we will call it as a massive blood transfusion. This one I already discussed in the previous session. Then we will discuss on the complication of massive blood transfusion. If we transfuse the massive blood, means you will store the blood, stored blood, that is cold blood, okay, that is around 4 to 6 degrees Celsius. If we transfuse the too much of blood, means that is cold blood means patient will go to hypothermia. Then we will see the arrhythmias. Then move on to the next one, coagulopathy. If we transfuse the more PRBC we are transfusing PRBC means this in the blood we have platelets and clotting factors. Okay, clotting factors also there. If we transfusing PRBC means these platelets and clotting factor become dilute. Okay, dilution happens. Then according to the homeostasis, platelets and clotting factor amount will be decreased because of this dilution, and there is a chance of bleeding also. Okay, bleeding can happen. Then move on to the next one, hypocalcemia. Why it will happen? Because of citrate toxicity. Citrate toxicity. We are transfusing the massive blood means more blood means in the packed RBC we will use the preservative or anticoagulant, that is CPDA. CPDA means citrate, P means potassium. Okay, then D means dextrose, A means adenine. This citrate used for the to prevent the clotting. So this citrate after transfusion, this citrate bind with the calcium. Okay, bind with calcium, and in the blood, if this citrate binds with the calcium means in our blood decrease in the calcium. That is condition called hypocalcemia. Okay, we will see the symptoms of tetany. Okay, then move on to the next one, hyperkalemia. Why it will happen again? In the PRBC, we will use the potassium as a preservative and chelating agent. Sorry, buffer. Okay, then old blood. If the transfused blood is old means in that old blood there will be a more potassium level. So after administration, potassium will increase and we will see the arrhythmias. Then coming to the volume overload, that is transfusion associated circulatory overload, TSU. Then we will see the symptoms of pulmonary edema and shortness of breath and circulatory overload also we will see. These all are important. Okay, these all complications are important in the massive blood transfusion. In from here they will ask so many questions. Then coming to the question, that is they are asking the citrate causes only. In massive blood transfusion we will see the these important complications, but in the question they are asking the citrate only. Citrate will bind with the calcium and decrease the calcium in blood. Okay, then answer of this question is A, hypocalcemia. Okay, let us move on to the next question. An old male patient receiving the normal saline through the IV line complaining shortness of breath and palpitation, and patient's assessment finding reveals the central venous pressure is 18 centimeter of H2O. What would be the priority nursing intervention? In this question, this is a priority question. Okay, this is the priority question. What is the condition here? Patient receiving the normal saline. Okay, after that he will complain the shortness of breath and palpitation, and assessment reveals the CVP is 18 centimeter of H2O. Let us discuss on the CVP. Okay, CVP is the central venous pressure line. We will insert the CVP catheter in the big vessels. Okay, here first point is CVP is the pressure measure of central veins. Okay, central veins, that is big vessels, and that is near to the heart. Okay, close to the heart. Like we will insert the catheter inside the subclavian. Okay, subclavian vein and internal jugular vein and a femoral vein. These are the best site for IVC insertion. That is also for first priority, and internal jugular second, third. These are important site for the CVP line insertion, and in that particularly CVP pressure monitoring we have to use the subclavian, that is also right side. Okay, then next point, it indicate means, okay, it indicate means if we insert the catheter and we will we will monitor the pressure of right atrium only. Okay, right atrial pressure, we will measure the right atrial pressure through the CVP line, and sometimes we will use for the estimator of right ventricular preload, that is we will see in the heart failure. Okay, that is we will see the symptoms of internal jugular vein bulging also, okay, and that is in pulmonary edema also, okay. Then coming to the next point, normal CVP in centimeter of H2O is 5 to 15 is the normal condition. Okay. Here in the question they have given 18 centimeter of H2O. So here what happened? CVP become increased. Then next point, normal CVP in mm of Hg. Okay, that is 2 to 6 mm of Hg. This is also important to note this. And if the CVP reading is low means we can suspect that is a hypovolemia or IV fluid should be administered. Okay, we have to infuse the more fluid rapidly. Okay, rapid to maintain the volume of correction of fluid. Okay, then see here lower side. Okay, CVP, if CVP is lower side means we have to consider that is as hypovolemia. In that we have to administer IV fluid. If the CVP reading is higher side, see, if a patient getting the IV fluid and patient having the high CVP means we have to immediately stop first. Okay, then after that position of CVP line is just inferior superior vena cava. See, this is also important, and we will monitor the pressure of right atrium. Okay, right atrium pressure, and we have to estimate the right ventricular preload also. So in this case, in the condition they have given patient getting the normal saline fluid also going and shortness of breath and palpitation. These all are the symptoms of pulmonary edema or right-sided heart failure. And patient assessment finds CVP is more than 18 centimeter of H2O. See, CVP is increased. Okay, CVP is increased. Now the patient is getting fluid. You have to stop the fluid. Okay, stop the IV fluid. Then coming to the options, continue the IV fluid. So CVP is increased. Okay, so we are not supposed to go into continue the fluid. We have to stop the fluid. And correct answer of this question is B, discontinue the fluid. Then coming to the option that is increase the flow rate of IV fluid. No, we are going to stop. Okay, notify the physician. This is also right, but they ask the priority one. So correct answer of this question is discontinue the fluid. Correct answer of this question is. Then next one, a drug is ordered 35 mg per hour in 500 ml normal saline. Available dose is 350 mg. Sorry, this is available dose is 350 mg. And what would be the expected flow rate? See, in this question they have given the order. Okay, order prescribed. Okay, prescribed dose is 35 mg per hour. Okay, 35 mg per hour, and volume is 500 ml. 500 ml, and water our okay available dose is 350 mg. So here in this question, what is they are saying means 350 mg. It is in the 500 ml. Okay, 500 ml fluid. Then this is prescribed dose is 35 mg per hour. Okay, this is in the question they are asking the flow rate. See, in this case, one formula is there, that is formula that is prescribed. Okay, prescribed dose divided by available dose into fluid volume. So here prescribed dose is 35 mg. Okay, mg per hour, and available is 350 mg, and volume is 500 ml. So we will cut this 0 through this 0, and 35 on the. Okay, now this is available is 50, and we will cut this mg also. Okay, what is remaining here? 50, and here ml also remaining, and here hour also there. Okay, our flow rate is 50 ml per hour. So remember this formula: prescribed dose divided by available dose into volume, and 35 mg per hour divided by 350 into 500. This mg also cut by this down mg and remaining hour and ml, and 50 ml is remaining. 50 ml per hour will be the our flow rate. Then the correct answer of this question is C, 50 ml per hour. Okay, this is our answer. See here, one word is this, sacrifice. If you want to get your dream job, if you want to get the dream job, you have to sacrifice something. Sacrifice something means you have to, someone will sacrifice their family for particular temporarily. Okay, someone will sacrifice their private job, sacrifice their loved one also. Okay, love, friends, and someone will leave their favorite games also. Okay, if you sacrifice these things, you will get that your dream job. If you won't sacrifice these means, your dream job will be become the dream only. Okay, so for your dream job you have to sacrifice something and you have to earn your dream job. Okay, if you don't want to sacrifice those things means, your dream job will be become dream job. Okay, the next one, which maneuver used to empty the urine bladder? See, in this question they are asking to empty the urine bladder, which one maneuver will be used? So in this question you have to use the logic. Okay, see in the option, coming to the option A, Craig maneuver, Leopold maneuver, Burn Marshall maneuver, and all of the above. First one, let us discuss one by one. This you know already, Leopold maneuver. If you know the Leopold maneuver, you will use in the OBG to assess the fetal position. Okay, fetal position you will use the Leopold maneuver. Then coming to the Burn Marshall maneuver, again we will use this maneuver in the OBG during the delivery time. Okay, baby delivery time we will use the this maneuver during the difficulty labor. And coming to the option D, now we are using these two manuals in the OBG itself, so this is not the answer. Then remaining is CRED maneuver. This is your correct answer. Okay, CRED maneuver is the correct answer. Let us discuss on the CRED maneuver. How we can do the this CRED maneuver? See, we will generally palpate. We have to pressure on the gentle pressure above the pressure above the pubic bone. Okay, simple as pubic. Okay, pubic bone to empty the bladder. Okay, this is pressure, gentle pressure above the pubic bone to empty the bladder. In whatever the condition you will use the CRED maneuver means, you will use in the urinary retention. That is also in the neurological problem. Okay, neurological problem. Patient having the neurological problem, that is urinary bladder. That time you have to use this CRED maneuver. Correct answer of this question is A. Okay, this is our session. I will come with again important